criminal justice system, sometimes the mental health system is a better place and a better fit, and that's what people really need. So working with the CBHLs has been a lifesaver, and it saves us time, and it prevents us from having to go to repeated calls and calls and calls on the same people. It's a win for us because we're able to focus on other areas that need our attention. It's a win for the client because they get the services and the help that they actually need, and it's a win for the CBHLs because they are doing what they're there to do. They're helping and changing lives.
It's a good thing. We partner with law enforcement. Law enforcement contacts us when somebody needs help, and then we can reach out to the person and we can direct them to help.
I've seen the impact CBHLs have made on each of our communities and the entire state of Missouri. The collaboration between community agencies has been some of the most exciting work I've ever done in my career. I would say the last 9 years of being a CBHL have been my most favorite part of my career, my most favorite job.
In 2013, as part of a strategic mental health initiative, Governor Jay Nixon announced new funding for mental health liaisons to work with local law enforcement agencies and the courts to facilitate access to care and improve the coordination of mental health services across Missouri. With this funding, 31 community mental health liaisons were employed by community mental health centers. Governor Nixon held a series of roundtable events around Missouri to bring key stakeholders together and discuss ways to continue to improve Missouri's mental health care.
Before we had the CBHL program, we were answering calls, we'd write reports, take people to the hospital, and that was about the end of it, or take them to jail. Now with the CBHL program, they're able to review those reports. They'll go and get those people engaged into treatment, and that can look at a lot of different ways. Can get them out of our jail system, gets them, whether it's the hospital, gets them into the mental health center, and they know the ins and outs of each of the mental health centers that they work for.
One thing that I've really noticed that's happened through the years is that we now have those relationships. When there's issues, we know who to call, they know who to call, we work on things together, and not just with law enforcement, but other first responders and other community agencies, the hospitals, the VA, our local emergency room.
In case nobody told you today, you're special. In case nobody made you believe, you're special. Well, I will always love you the same. You're special. I'm so glad that you're still with us. Broken, but damn, you're still perfect. Special.
As a law enforcement officer, so many times I just did not know what to do with an individual in crisis. Until the CBHL program started in 2013, 2014, became the first resource for law enforcement to actually have a person within that profession that you can call and link that person up with services. Law enforcement wellness is near and dear to our hearts, and those CBHLs, just having that clinical side of things can help an officer kind of work through a struggle that they may be personally dealing with. And really that's just an invaluable relationship to have.
I don't think that anybody foresaw it going the way that it has in the past 10 years, and I think the next 10 years will be amazing to see what happens. But most of all, I would love to say thank you to all the CBHLs. What you do is way more than we ever give you credit for, even though we give you a hard time, and I would not be where we are today as a program without your help. So thank you very much.
So I will never forget that initial meeting 10 years ago when the 31 of us got together and learned about what it means to be a CBHL or CMHL at the time. And Dr. Gowdy and Christine led that meeting, and they were excited and motivated, and probably none of us had any clue as to what was going to be unfolding over the next 10 years. Love the way that this position has morphed into also caring for our officers that prior to CBHLs didn't have a lot of support for their mental health. And so I love the different initiatives, the PCIS, the provider network, all the law enforcement that reach out to ask for that help. I think that's been really a beautiful development that I don't think was initially anticipated in this.
Wow, 10 years. I cannot believe that community behavioral health liaisons have assisted citizens involved with the criminal justice system for now 10 years. I can tell you in Jefferson City and in Cole County, where I serve as circuit judge, they have become invaluable to everything from our treatment court all the way to our municipal court.
Congratulations on to all the CBHLs, the ones that are still with us from the beginning, the ones that have come along and contributed so much, and to all the new ones from the expansion side, you know, that we're at 81 right now. So thank you to all the CBHLs out there. Keep doing the great work that you're doing in the state.
Hello, community mental health liaisons. So incredible to recognize you and your amazing work for the past 10 years. You're now called community behavioral health liaisons. I'm so proud my daughter is one of you and serves in that role. We are just inspired by the incredible work you do each and every day. For those of you that have been with this program from the beginning, many of you are now supervisors and leaders in the field. We are so grateful to you for your pioneering work. Keep it up. We're so proud of you. Amazing stuff all the time. Thank you so much.